Well, a Lafayette pharmacist says we're experiencing the worst drug shortage that she's seen in decades.
News Channel 18's Kristen Marano has more on how that could be affecting your hospital care. Kristen.
Gina, Jeff, Franciscan St. Elizabeth Health Clinical Manager Carol Miller says the shortage we're seeing now has been getting worse for about 2 years. Now Miller says she's starting to worry about patient care.
It used to be like drug of the quarter that we were short. Then it was a drug of the month, and now I'd say it's drug of the week, drug of the day. Now what are we out of?
Clinical Manager Carol Miller says that question is coming up more and more often at the pharmacy at Franciscan St. Elizabeth Health. A drug shortage is hitting hospitals and pharmacies across the nation, and Miller says Lafayette is no exception.
As pharmacists working for 20-some years, I've seen shortages, but nothing with the numbers of drugs that are short at this time.
In the IV drug room alone, we asked Miller to show us some examples of drugs in short supply.
This has been back and forth off and on.
Miller says one way this shortage stands out is the involvement of doctors and nurses. She says in years past, pharmacists didn't always need to tell the doctors when they were short on drugs.
We are having to call the physicians and say, hey, what about this alternative? Or actually, doc, I have no alternative for you.
She says the shortage leads back to the drug makers. With a tight economy, drug companies will often stop producing the meds that bring in the least amount of money. Miller says when generic brands come into play, brand name companies could stop making the drugs altogether.
It takes a while for generic companies to ramp up production and get everything in place with all the federal regulations.
Miller says that low supply can also lead to higher prices for patients. Miller says the short supply of drugs has been made even worse by what she calls the gray market, where people buy large quantities of drugs when they hear the supply of those drugs is tight. That Miller says the sellers offer the drugs to hospitals for as much as 20 times the market price. Kristen Marano, News Channel 18.